Come on.
Ow. Ow. Ow.
Oh dear. Ah. Along now. That's it. There we go. Come along. There we go. That's it. Sit up straight. And now. There we are. And. Oh! Oh, yes. Oh, dear. There, dear. Oh, poor man. Oh, dear. Oh, right. Now then. Oh.
In 1895, a physicist named Wilhelm Röntgen was doing experiments with a cathode tube, a glass container in which a beam of electrons lights up a fluorescent window. He had wrapped cardboard around the tube to keep the fluorescent light from escaping when something peculiar happened. Another screen outside the tube was glowing. In other words, invisible rays had passed through the cardboard. Wilhelm had no idea what those rays were, so he called them X-rays, and his discovery eventually won him a Nobel Prize. X-rays are powerful enough to fly through many kinds of matter as if they are semi-transparent, and they're particularly useful for medical applications. Can make images of organs, like bones, without harming them, although they do have a small chance of causing mutations in reproductive organs and tissues like the thyroid, which is why lead aprons are often used to block them. When X-rays interact with matter, they collide with electrons. Sometimes the X-ray transfers all of its energy to the matter and gets absorbed. Other times, it only transfers some of its energy, and the rest is scattered. Or if it's made of elements with higher atomic numbers, which means more electrons. Bones are dense and full of calcium, which has a relatively high atomic number, so they absorb X-rays pretty well. Soft tissue, on the other hand, isn't as dense and contains mostly lower atomic number elements like carbon, hydrogen, and oxygen. So more of the X-rays penetrate tissues like lungs and muscles, darkening the film. These 2D pictures are only useful up to a point, though. When X-rays travel through the body, they can interact with many atoms along the path. What is recorded on the film reflects the sum of all those interactions. To see what's really going on, you would have to take X-ray views from many angles around the body and use them to construct an internal image. And that's something doctors do all the time in a procedure called a CT, computed tomography scan, another Nobel Prize-winning invention. Think of CT like this. With just one X-ray, you might be able to see the density change due to a solid tumor in a patient, but you wouldn't know how deep it is beneath the surface. However, if you take X-rays from multiple angles, you should be able to find the tumor's position and shape. A CT scanner works by sending a fan or cone of X-rays through a patient to an array of detectors. The X-ray beam is rotated around the patient and often also moved down the patient's body, with the X-ray source tracing a spiral trajectory.
In some CT scans, a dye called contrast material is taken by the patient through injection, solution, or inserted rectally. This dye makes structures and organs easier to see on the pictures. Because of the extreme accuracy and detail of these pictures, CT scans are used for a myriad of the body's internal situations, including internal injuries from trauma, muscle and bone disorders, detecting lung and liver diseases, and also detecting different types of cancer. CT scans provide advantages in comparison to an MRI scan, as they provide higher resolution pictures. However, they do pose some risks as well. The ionizing radiation from the X-rays has been linked to increased risk of cancer, although it is a low possibility. The most common risk of CT scans is a reaction to the contrast material, which is generally mild and results in hives or itchiness. Similar to MRIs, pregnant women should not undergo CT scans in order to avoid radiation exposure to the fetus.
Spiral CT scans produce data that can be processed into cross-sections, detailed enough to spot anatomical features, tumors, blood clots, and infections. CT scans can even detect heart disease and cavities in mummies buried thousands of years ago.
Well, what exactly is an MRI? An MRI, which stands for magnetic resonance imaging, is a technique used to generate an image of one's body non-invasively. When undergoing an MRI scan, a patient lies on a movable bed which is surrounded by the MRI scanner and a circular magnet. Radio waves 10,000 to 30,000 times stronger than the magnetic field of Earth are sent through the body. As we all know, our bodies are mainly composed of water, which contain hydrogen atoms. These waves cause the nuclei of the atoms to change position. As the nuclei move back into their original positions, they emit their own radio wave, which the scanner picks up and ultimately turns into a picture that is seen on a computer. For the most part, this procedure is painless and risk-free. It should be noted that pregnant women or anyone with a pacemaker or any sort of metal implant cannot do an MRI scan due to its powerful magnetic force. A positron emission tomography scan is performed by using a special dye that has radioactive tracers. The patient injects this tracer and it is subsequently absorbed by organs and tissues in the body. The PET scanner can highlight these tracers and see how well organs and tissues are performing. PET scans can therefore measure blood flow, oxygen use, and glucose metabolism. A major difference between PET scans and the two previous scans is the ability of a PET scan to show problems and complications at a cellular level. The resolution might not be as clear as an MRI or CT scan, however it gathers more functional information. To prepare for a PET scan, the patient must notify their doctor about any medical conditions and if they are pregnant. In some instances, it is advised that the patient does not eat for 8 hours prior to the scan. Risks associated with a PET scan are similar to those of a CT scan, including exposure to radiation and allergic reactions to the injected tracer. The MRI, CT scan, and PET scan are three of the most commonly used techniques for medical imaging. We learned the benefits associated with each, such as the high resolution provided by the CT scan, or the functional information given by the PET scan. Furthermore, we also learned about the disadvantages and risks associated with these scans, such as the possibility of an allergic reaction to the tracers in a PET scan, or the exposure to high radiation in CT scans. In conclusion, the benefits outweigh the risks in all three of these scans, as they provide essential information for patients and healthcare providers in need of help.
Hi everyone, Julia here for D News. Most of us have gotten an x-ray at some point, either at the dentist or maybe when we break a bone, but I always had to wear an uncomfortable heavy lead apron. And that makes me wonder, are x-rays safe? And how the hell can they see through me? X-rays are another form of electromagnetic energy, which is a long spectrum. Visible light, which we can see, just makes a tiny part of it. On one end are radio waves and on the other end gamma rays. X-rays have waves that have a higher energy and are a little longer than gamma rays, but a little shorter than visible light. We can't see them, but they can sure see through us. They were discovered in 1895 when a German scientist was experimenting with passing electrical currents through gas in tubes. These tend to light up when hit with electrons, so Wilhelm Conrad Röntgen covered up one of his tubes with a box, but he noticed something strange. An object nearby glowed. He assumed that some type of energy was getting through the box, but wasn't light. But he didn't know what kind of energy it was, so he called it X, hence X-ray. He found that it passed easily through some objects, like our soft tissues, but not through other objects like our bones or lead. He produced the first image of an X-ray by taking a radiograph of his wife's hand in 1895. It was heralded as a medical miracle. Suddenly, the new technology took off. Everybody was using it to find breaks in bones or bullets lodged in bodies. But soon, people noticed some problems. Early X-ray technicians started having skin problems on their hands. Their skin would get dry and scaly, or they'd get burns, or their hair would fall out. After a while, the damage would be so severe they'd have to amputate fingers, hands, sometimes whole arms. Dozens of people died from radiation exposure. But no one really seemed to take heed. People still used X-rays for removing unwanted facial hair or for shoe fittings in department stores. Not surprisingly, people got sick. Women who got X-ray treatment to remove hair wound up with dry, scaly skin, enlarged blood vessels, and finally, some developed cancer. But is it safe now? Well, we certainly learned our lesson from those early days. X-rays are still considered a carcinogen by the World Health Organization, and one study published in the journal Cancer found a link for a slight increased risk for certain brain cancers and frequent dental X-rays. Another study published in the journal Lancet found an up to 6% risk of cancer from diagnostic X-rays. But we have come a long way. Medical X-rays in the 50s used almost 100 times the radiation now considered acceptable. Basically, the amount of radiation during an X-ray is pretty small. According to the FDA, an X-ray of your bones in your hands or feet is pretty comparable to a day's worth of natural background radiation. But other procedures have different levels of exposure. And there are enormous benefits to X-rays. The pros by far outweigh the cons. They're an incredible diagnostic tool. They find things like bone breaks, blood clots, tumors, and many, many more things you really want to know about without invasive exploratory surgery. And don't be afraid to ask questions. Make sure it's medically necessary and ask to wear the protective shields. They're like a lead apron or a neck guard. And since radiation is cumulative over the course of your life, keep track of your X-ray history and make sure your medical professional knows. X-rays catch far more cases of cancer than they cause. Speaking of catching cancer, it seems South Korea is overdiagnosing this disease.
So what began as Röntgen's happy accident has become a medical marvel. Hospitals and clinics now conduct over 100 million scans each year worldwide to treat diseases and save lives.